Thank you, Sarita. Would quickly tell you about what's happening in India. Uh, the Indian Innovation Collaborative is based on the recommendations, Lancet Commission, and the Future of Nursing report, uh, where the leadership is talked about, transformative leadership is talked about, interdependence in education is talked about. In that context, we propose to actually design and develop interdisciplinary leadership competency model for training of, as a part of the curriculum of medicine, nursing, and public health students, and for in-service professionals in India. And how did we do that actually? We thought that we should follow a very systematic process, and we looked at the curriculum of nursing, medicine, and public health graduation in India. And we found that the cross-cutting competencies like leaderships are completely missing from the curriculum. Of course, I graduated a long time back, but Himanshu is a recent graduate. Nobody talks about the cross-cutting competencies actually. It's a content-specific focused curriculum. And in that context, we thought that it's important basically to advance the agenda of reforms in education and health professionals. We need to see that how do we actually incorporate into the curriculum the cross-cutting competencies which are equally important. In that context, we did the curriculum scan and we found realities like this. And then the next step was basically to look at the literature. We constituted the technical advisory group to advise us on this particular issue, and then three institutions: a nursing school from Pune is in western part of India, then Public Health Foundation of India, we have a public health school, and a medicine school in central India. We partnered as part of this initiative and developed this particular model. When we looked at the literature, we initially looked at the literature for leadership competencies and skills desired and required in a larger context of the healthcare sector. And then we specifically looked at, but what are the leadership competencies which are desired for nursing professionals or for medicine professionals, doctors, I mean, for public health professionals. And when we actually started looking at shared and collaborative leadership competencies, we struggled actually. In fact, when we started looking at what does it mean a collaborative leadership is all about, what shared leadership is all about, and the frameworks and models for that, we really struggled actually. And there's a very limited literature available in that particular context. So what we learned from the literature review, then we thought that it's also important to talk to key stakeholders in whole process. We talked to some key people, educationists, and some Ministry of Health and Family Welfare, some professional, even students also. And then we tried to gather information from various key stakeholders. So based on curriculum scan, literature review, and by talking to these key stakeholders, actually, we identified leadership competencies. Based on the leadership competencies, which are interdisciplinary in nature, we developed then a training model. And recently we conducted a pilot of this training. We designed a 3-day training program for in-service professionals, and the undergraduate curriculum for medicine, nursing, and public health as an integrated, interdisciplinary, interprofessional way is being taught. And we recently, last month only, we conducted the pilot training, and we are analyzing the recommendations coming out of that. We would certainly look at the feedback which emerges from this and try to refine this model. The next steps include that we wanted to see that this training program, this training model is incorporated in a regular curriculum for medical, nursing, and public health education in India, number one. Number two is that we also wanted to see that how do we actually figure it out that it also gets incorporated in several initiatives, including National Rural Health Mission initiative in India for the in-service professionals, because a lot of people are actually in field and it's important to build their skills. So these two areas, and the important feature of this initiative is that we are working very closely with the state governments, the union government, the Planning Commission, the Indian Council of Medical Research, all the councils actually, the Medical Council of India, the Nursing Council. So they are important stakeholders involved in this process. So we see that it will be easy basically because they have been on page one from the day beginning itself, and then they understand the whole scenario, and we'd be very hopeful that to incorporate that into the undergraduate and the in-service training programs in India to see that advancing the agenda in the context of leadership, interprofessional competencies for taking this forward and contributing towards the reform in educational health professionals in this part of the country. Thank you.